And the problems that we'd identified were in relation to the numbers of services that we've had who were struggling with the amount of referrals that they were getting. And we recognised that we have a number of very specialist services that have some fairly strict criteria around them, which actually meant that some patients were being referred into some services that didn't meet that criteria, so they were then being referred on to another little bit of a service. They didn't quite meet that criteria, and the referrals were being bumped around all the services until eventually they found the correct service. So what we had was a really complicated service for the people who were trying to refer to us, for some of our patients and for some of our staff. And there was inequity of some of those services right across the county. I think we all know the NHS has got some significant financial challenges. We've got a much bigger older population, so we recognise that the numbers of people being referred into our services was increasing, but the money is shrinking, and that's not just the money from the Health and Care Trust, but that's also within social care and also within our commissioners as well. As an organisation, we are signed up to the values of co-production, so that is the complete design of our services alongside and in partnership with our service users, their carers, their families, and all the other people. We call them stakeholders, but all the other people that are involved in those services. So what we did to start off with, we held 4 workshops, different parts of the county, different times of day. We invited everybody that we could think of. So we invited patients and carers, the voluntary sector, primary care, doctors, all of our stakeholders. We invited everybody in to tell us what we thought was good about our services, what the bits of our service that work really well, and the bits that weren't working quite so well, the difficulties that patients were having, that families were having, that carers were having, so that we could really build on maximising the things that work really well and eliminating and certainly minimising the things that all our stakeholders were finding difficult. Based on what all the feedback from all those 4 sessions, which were really well attended, we built a model based on what everybody was telling us. So the key changes that everybody told us about was that we are referrals into the service, how you access this service, all of our services, is really complicated. So there's a fundamental change in that we will have one point of access for the whole of this service, and that'll be for all of our referrers into that service. So there'll be one place to go, and at that point you get some guidance about whether we can meet that need. We are strengthening our links with the voluntary sector and our primary care colleagues in a much more joined up way. We're making services streamlined, we're building partnerships with them so that we know that patients who don't need our service but are supported by the voluntary sector, so that those people don't slip through the net. We're making our services consistent in the north of the county and in the south of the county, so that what's available to you if you live in Wyre Forest is the same as what's available to you if you live in Evesham. And we are strengthening the links between the elements of service that have previously been separated. So for example, if you get a dementia diagnosis within one of our services, and you also have depression or another mental health need, historically you would have had to go back to your GP to get a referral into the other bit of the service. We're joining up all those services now, so they're working much more closely together in order to meet the patient's need, where the patient's need is, that they absolutely value our services. We've got some brilliant clinicians doing some amazing work, but a lot of our patients, we keep them in our services for far too long, and that's what patients told us, that they wanted easy access in, they wanted to benefit from the support when they needed it, but actually they wanted to be discharged quickly back out to see their own GPs as quickly as possible. So we want to work with patients to make sure that happens, but also make sure that GPs can refer back into our services as and when that's needed.